Hello 11 and welcome to the final video of OCR History B People's Health, which is 1900 to present day, which is the modern period. This is the period that all of you will definitely be the most comfortable with because you are able to speak for the majority of questions about evidence that is right up to modern day. So just a quick recap on the overall timeline for people's health, which has been in all the other videos as well. We have medieval Britain, which is 1250 to 1500, the 13th to the 16th century. We have early modern Britain, 1500 to 1750, which is the 16th to the 18th century. We have industrial Britain, which is 1750 to 1900, and that is the 18th to the 20th century. And finally, we have the time period that this video will be focused on, which is modern day, which is 1900 to today, and that is the 20th and the 21st century. It is worth a reminder here just once again that you will need to know the names of the time periods as well as the dates and the centuries. The exam board can ask you a question, for example, that focuses on the 19th century, and you would need to know that this is speaking about industrial Britain. So please make sure that you are aware of the dates, the names and the centuries for each of these time periods. So in the previous three videos, I've spoken you through the content for medieval Britain, early modern Britain and industrial Britain. This final video will focus on Britain since 1900, and it will focus on the economic, political, social and cultural overview, living conditions and lifestyles with housing, food, air quality and inactivity, responses to the epidemics for this time period, which were Spanish influenza and AIDS, and finally growing government involvement in public health, including pollution controls, anti-smoking initiatives and the promotion of healthy lifestyles. So firstly, we have an overview of modern Britain. A lot of you will be familiar with this period of history, and that's great, obviously, if you get a modern question in the exam. So we're going to start off with society. So in 1900, right at the start of our time period, we had lots of the population still working in heavy industry, with the majority of people being working class, so on lower incomes. We had no welfare state, so no kind of NHS set up, no funding from the government really to help the majority of the population. Most people were still attending church, and the life expectancy of people in Britain during this time was just 50 years old. By the year 2000, this has changed hugely. The vast majority of people belong to service industry jobs such as tourism, education, healthcare and finance. There's been a huge increase in this, and this has led to the majority of people becoming what is known as middle class. The welfare state is well established, so we have the NHS being established in 1948. We have less than 10% of people attending church, and the life expectancy of people as a result really of the welfare state increasing, such as changes to the NHS, has led to life expectancy rising to 77. In terms of democracy, from the 1880s, most men had the right to vote, but women over 30 didn't gain the right to vote until 1918. And it isn't until 1928 that every adult in the country could vote. And this means that everybody is able to have a say on how the country is run, which leads to the government having to do more to provide for the needs of the people that have voted for them. In terms of technology, at the start of our time period, we only had a very few cars, and these were just for the very wealthy. There were no aeroplanes. Electricity was starting to become popular. But by 2000, we've got cars and air travel, which are a normal feature, telephones, internet used to communicate, electricity in almost all homes. Obviously, in the exam, you can speak about really modern technology as well. So you can speak about smartphones, you can speak about electric cars in terms of air pollution. So please feel free to utilise those examples that you have of more modern technology. This is just a comparison from 1900 and 100 years later. In terms of welfare, by 1911 the government had introduced free school meals and the first state-funded old age pension, so they are looking after the youngest and the oldest in society. The government were using taxpayers' money to provide for the needs of all of society. So in 1948, the biggest example that we have of this is the Labour government introducing the National Health Service. Finally, we have people and population. So the population of Britain in the year 2000 was around 58 million, with more people than ever living in cities. There is a large mix of ethnic groups as many Commonwealth citizens moved to Britain after World War II to find work. So for the previous time periods that we've looked at, living conditions would have included housing, food, water and waste. Because we're in the modern period and water and waste had pretty much been sorted for the vast majority of the population towards the end of the industrial period, within a modern question on living conditions, you would tend to focus just on housing and food. So we're going to start with housing, and there are three main turning points that you need to know about throughout the modern period, and you would need to know the impact that they had on housing. The information that will appear on the screen in a moment is going to be red for negative and green for positive. So the first turning point that we have is the First World War. And in terms of positive impacts, the government began to take responsibility for public housing. So 50% of the promised 500,000 homes were built, and remember these were known as Homes for Heroes. And we had the 1930 Housing Act, which led to slums being cleared, which obviously helped in terms of people's health because there are less diseases and respiratory or breathing problems. So all of these are positive. You can clearly see that we've only got 50% of the 500,000 homes being built, but it is a step in the right direction. That statistic really of only being 50% links to the fact that it is quite slow progress by the government. But that Homes for Heroes slogan, that would be a great term to use in the exam. We then see the Second World War as a turning point as well, and this leads to, following this, a rise in the number of cheap high-rise accommodation that is produced, examples such as the one that you can see on the screen. These had gas and electricity, and they were built due to the damage to homes that had been caused during the bombing campaigns of the Second World War. So this is why we get these new high-rise flats appearing. In terms of a negative, there's lots of community spirit that is destroyed by these high-rise flats due to a loss of the back-to-back communities that had been established. So as much as back-to-back housing in the industrial period wasn't particularly sanitary, there was a real community spirit there, and this is lost with the increase in high-rise accommodation. The final turning point that we have is Margaret Thatcher's government. So the impact that she has on housing is massive, and it is something that we still feel the impact of today. So in terms of a positive, people were encouraged to buy their council houses, which gave them the opportunity to build their own home. But what Thatcher's government didn't do is replace the houses that they sold. So this left many of the poorest people needing to rent from private landlords, who charged much higher prices for lower quality accommodation, which affected the health of the people within them. So as much as buying your house sounds like a really positive move, if they're not replaced, then this leads to a lack of council housing for lots of the population who need it most. So they are the turning points that you would need to know, and the impacts on housing, which I've categorised into positive and negative. The other element of living conditions that you could discuss for a modern question is to do with food, and we have 5 main factors that affect the food that is being consumed, and this obviously has an impact on the health of the population. So the first factor is war, with World War I and World War II both taking place during this time period. You'll see the ration book that is on the screen, and I'm sure that you will recognise this from either even primary school history lessons as well as your lessons in class. So during World War II, imports fell and so food was rationed. People were encouraged to grow their own food and keep animals, and rationing actually improved the quality of some people's health due to more homegrown produce being available. So there was food available for people, but this was limited, but some people actually benefited from this. Unsurprisingly, in the modern period, we're going to speak about technology a lot, and the technology that really impacts the food that we eat is refrigeration and canning in particular. This improved the supply of food and made it cheaper, and home refrigerators allowed people to keep food for longer. Alongside this, in the 1970s in particular, there was a rise in microwaves being available in the home, which led to a rise in convenience foods. We know that convenience foods tend to be filled with fat, sugar and salt to make them tasty, and obviously as a result of this has a health impact on the population. Along with this, food delivery services in modern England, so you know that you have apps on your phone, lots of you will have takeaways kind of delivered through that. So we know now we don't even have to leave the home to get access to food, which has led to an increase in the levels of obesity. So that is something that you could also reference in the exam. In terms of wealth, after 1950, people became wealthier and could afford the new technology available to them, such as the fridges and the microwaves, which again affects the food that people eat. We also had an increase in credit that is available in the second half of the 20th century, and this also enables people to buy the technology that is going to change the way that they eat without paying for it with cash up front, which means that more people will have access to this technology and to new types of food. In terms of immigration, the amount of immigration increased following the Second World War, again in the second half of the 20th century, and we see a reflection of this in the diet of people in England. So new cuisines such as Indian and Chinese food becomes a staple part of lots of people's kind of weekends with takeaways, etc. Again, quite high in fat, in sugar, in salt, so this does have an impact on people's health. And finally, we have fear. So the disease BSE, also known as mad cow disease, affected cattle, and spread into the human food chain. There was a real worry about this, and this led to a demand for fresh produce. So you will see in the supermarket that organic produce is available to you, and there was a real worry that people needed to buy this kind of produce to improve their health, again towards the end of the 20th century. Recognise the image that you see on screen. This is an image that we have analysed in class, and it really indicates the problems that have appeared during the modern period. So as time has gone on, humans have become very unhealthy and overweight, which is due to advancements in society such as technology. You can see the final human in the evolution cycle on screen, sat at a computer, eating convenience food with a fizzy drink. So we can see the impact that technology has had, and a changing economy as well, moving towards this consumer society, which again we've just spoken about, takeaway food. The service economy has also aided this, so there are people who will provide services for us, which means that we can choose whether to complete tasks ourselves or ask someone else to do that for us. So that image really does sum up the kind of new health problems that modern society are dealing with. So in the first half of the 20th century, we also had a new health problem of smog, which is smoke and fog mixed together. In the big industrial cities such as London, this tended to come from factories, and it did cause conditions such as pneumonia. An event that you could reference in the exam was the Great Smog of 1952, where lethal smog covered the city of London for 5 days. It was caused by a combination of industrial pollution and high pressure weather conditions, so you could definitely reference that as an issue in the modern period. You can see the policeman stood in kind of the background, which you can see is very blurred due to the smog, and he has a mask on as well to help in terms of his breathing. Despite the success of the Clean Air Act, which was in 1956 and made people burn smokeless fuel and helped stop killer smog, since 1980, the huge increase in car ownership and other forms of transport have increased levels of air pollution. So again, you could reference the fact that lots of people are driving cars that have caused this pollution. You could, on the flip side of that, also discuss the new movement towards electric cars, providing the question says that you can talk up to very much modern day. We also have labour-saving devices such as cars, televisions, games consoles, computers, phones and tablets, and these have all led to people becoming increasingly inactive, which as a result of this we have higher levels of obesity, of high blood pressure, of heart attacks, etc. So this could all be discussed in the exam. And finally, since the 1980s, Britain has faced a number of health scares about its food, including the amount of sugar consumed by children and adults. So you can see on screen the rotten teeth, which are from a child as a result of having too much sugar. And this is leading to problems such as obesity, diabetes, and tooth decay, all of which are costing the NHS a huge amount of money, and all of which are problems that you could refer to in a modern question about health problems. So for the modern period, there are two epidemics that you would need to be confident to speak about, and the first of these is the Spanish flu. So between 1918, right at the end of World War I, and 1919, Spanish flu, which can also be known as Spanish influenza. So just to let you know that a couple of the exam questions have referenced Spanish influenza, please don't let that throw you. It's just another word for the flu. So Spanish flu or influenza killed almost 3 times the amount of people worldwide as World War I had between 1914 and 1918. So a huge epidemic, a huge issue for the world to deal with. The flu started with cough-like symptoms such as a high temperature, aches, pains, coughing and sneezing. And these quickly turned into pneumonia, which is a lung disease, where the skin then turned blue and there was bleeding from the nose, ears or stomach. How did the government respond? There is a name that you need to know for the exam, and that name is Dr. James Neven. So as the town's medical officer, his actions during the Spanish flu epidemic were so significant that a BBC television drama was produced about him in 2009. He encouraged some of the following, so face masks. We should easily be able to remember face masks for Spanish flu because we've just lived through COVID where we've all had to wear them. So face masks is definitely something that I would speak about if you get asked about an epidemic in modern times and you are linking that to Spanish flu. He also encouraged newspapers, films and posters to give advice on how to prevent contamination and insisted that theatres and cinemas could only stay open if they had good ventilation and were disinfected between shows. So the name Dr. James Neven is one that you need to know, and you would need to know some of the precautions that were encouraged by the government. So the second epidemic that you could reference in a question for the modern period is AIDS. You do not need to know what AIDS stands for, but it is acquired immune deficiency syndrome. And this is not a disease, but a medical condition. The virus which causes AIDS is HIV, which is human immunodeficiency virus. And we now know today that it is spread through blood or bodily fluids, but that was not always the case. So there were 5 distinct phases of reaction to AIDS in the UK, and you would need to know how the government responded at different times. So initially in the 1970s to 1983, we have a raised awareness of the disease but a negative reaction to it. So homosexuals and drug addicts in particular become stigmatised, and the disease was seen as very shameful. And this leads to, within 1984 to 1985, alarm and fear that AIDS could spread through contact with a victim. So this is the idea that if you touch the hand of someone, if you come into contact with them at all, then you would contract the disease, which is not true, but this is what people believed at the time. This led to huge isolation for victims, so causing huge mental health issues as well as suffering from the disease. Between 1986 and 1987, there was a better understanding. So lots of you I know in lesson will have seen this image here, where we have Princess Diana shaking hands and hugging an AIDS victim, showing the disease was not spread through touch. So these publicity campaigns massively helped to educate the public, and that is in, if you couldn't remember 1986 to 87 and you just said in the late 1980s, that would be fine, as long as you reference Princess Diana and the fact that she proves that it's not just any contact with a victim that leads to a contraction of AIDS. Between 1988 and 1995, we see acceptance. So the TV and the media embrace the need to publicise the disease and the need for support for victims. So there was support for charities and research, for example, the Freddie Mercury tribute concert. And finally, from 1966 onwards, We have seen a worrying decline in the awareness of HIV and AIDS. So because it's not the forefront anymore of our kind of national campaigns, the educational campaigns have stopped, and HIV and sexually transmitted infection cases are on the rise again. So the epidemic of AIDS and HIV is one that you would reference or could reference for a modern question, but you do need to know the different phases of response from the government. So I'm going to speak through some examples of public health laws that were passed within the modern time period. There are more examples in your revision guide on page 28 and also in your exercise books from work completed in class. But because this is an overview for revision, I'm just going to discuss 5 different laws that were introduced. The NHS I have just put on screen in big letters already because this is one that you absolutely need to be able to refer to. If you get a question on public health in modern Britain, please know about the NHS. Everybody can write a paragraph on that, so that is really your go-to for the modern period. But I am going to talk about 5 different laws that were passed. The first one in 1906 is free school meals, and in terms of its significance, it provides a hot meal for some of the poorest children. It became compulsory in 1914 that all local councils had to fund free school meals for children that needed that. An easy way obviously to remember that date is it's the start of World War I, so that might help some of you. And we also get the introduction of the school milk scheme in 1934. Now that is something that is still continuing today. It's something that you will have had or might remember even when you were at primary school. So allowing school children to have access to free milk, and this happens from 1934. In 1911, we see national insurance introduced for the first time, and this protects against unemployment and sickness by providing money for people to live on, and it still exists today. So it's something that we pay towards from our wages that you will have to when you leave school. So it has a long-term impact, and it is something that you can reference in terms of public health changes. In 1919, we have the Housing Act. So this was the act, remember, that promised the 500,000 homes for heroes. We spoke earlier about the fact that economic issues following the war meant that only half of these were built. We have a series of housing acts over time which led to slum clearances, council housing, and government recognition that housing was social responsibility. So because it is their responsibility, we see an improvement in the quality of homes that are available. In the 1940s, we see the immunisation programme. Again, this is something that you will have all gone through. So you'll have had injections when you were younger, something that continues today. And the mass immunisation programmes against diphtheria started in 1940, and for tuberculosis or TB started in 1948. So vaccination became routine under the NHS. You might still have a copy of your Red Book at home until very, very recently. The Red Book still in physical paper copies were still given out. So babies still have their Red Books today, which again indicates the long-term impact of the immunisation programme, and that will have obviously contributed to people living longer and having healthier lives. So if you were to explain that in the exam, that is the route that you would go down. And finally, as I alluded to at the start, we have the introduction of the National Health Service, or the NHS, in 1948. Again, for those of you that it helps, please think that this is the 3 years at the end of World War II. So try and think about that if you are struggling to remember the date. And obviously the impact of this is huge. It's free medical health care for all UK citizens. Remember, this obviously includes all your NHS services, so not just hospitals, dentists, etc. Healthcare was no longer a luxury that only the wealthy could afford, and life expectancy now, as a result, or a huge contributing factor in this increase in life expectancy, is the NHS. So the life expectancy now in the UK is 83 for women and 79 for men. So a huge change throughout our time period when we think that the average life expectancy in 1900 was just 50 years old. Section of the modern part of the course is government intervention, and there are a couple of examples that I think you'd be very, very confident speaking about in the exam. So I'm going to go through intervention for smoking and for obesity. So in terms of smoking, in 1962, the link between smoking and cancer was accepted. So the government began to introduce measures to encourage people to stop smoking. So between 1964 and 2016, the government took steps to tackle smoking, including banning cigarette advertising in the 1960s, promoting nicotine replacement products from 1998, banning smoking in public places, which was in 2007, and putting picture warnings of illnesses created through smoking on packages. So these are the kind of images that you will see today, and that happened from 2007. So this is a huge intervention from the government. You will also know that quite recently in the news there has been even stricter intervention that's been introduced by the current government, stating that children who are 14 will never be able to legally purchase tobacco. So the idea is that smoking will just be completely phased out. So we clearly here see huge government intervention due to the health risks that come about as a result of smoking. So you could speak about any of these in the exam. If you can't remember the dates for the specific interventions, please don't worry, but you would need to be able to reference them confidently. In terms of obesity, the government has started to try and tackle this problem because of it being a major cause of heart disease, strokes, diabetes, etc. So you'll see that the image that's just appeared on the screen, which I'm sure is something you'll be familiar with, is having one of your 5 a day, so your fruit and vegetables. Campaigns such as Couch to 5K you might be familiar with. Some of you might have downloaded the app for that at some point, trying to encourage people to move more and to eat more healthily. So these are there to try and help the public with managing their weight and make healthier choices. The government, however, are under criticism for acting too slowly with smoking due to the worry of a lack of revenue from tax on cigarettes and not doing enough to help with childhood obesity. So there was supposed to be a ban on advertisements on high sugar and fat foods until after the Watershed on TV at 9 p.m, but this has been delayed until 2025, which proves that the government potentially are under criticism for acting too slowly. That concludes the knowledge videos for the people's health. On this last slide, as in the previous videos, you have a number of past paper questions from the modern time period. You can see once again that the exam board used centuries, dates and names, or a combination of these, to identify modern Britain, meaning you need to be confident with all 3. So have a go at some of these questions as a part of your revision and use the how to answer the questions video to support you with this. Just as a final note, I just want to point out that this question here for an 18-mark question does cap you at the year 2000, so just be aware of that. Some of the questions could not run right up until modern day, so please keep an eye on what the question date is and make sure that you only include applicable evidence.